Hi, I'm Marie Hopkinson. Welcome back to the Chinese Medicine Podcast. It's my privilege today to be interviewing Julie Constantine, an acupuncturist and a Chinese herbalist in Brisbane. Whereabouts are we today?
We're in Bowen Hills today.
Bowen Hills,
filming
in her beautiful clinic. And we're going to be talking about a really interesting issue about self-care. Now, Julie's, I know Julie from a long time ago. We actually trained back in Perth, back in the day. We trained in Chinese medicine. Julie's gone on to do lots of other things throughout her practice. And we're going to be talking today about self-care and what are the most important things that you need to know, understand. It's something that people, when they're going through acupuncture, they might be really needing to kind of do other things to help their treatment along, maybe, right? So
yes,
welcome along,
right.
Julie.
Thank you.
Awesome. So can you tell us a little bit about your background and how you got to study Chinese medicine? Why did you choose to study Chinese medicine?
Well, actually, I've been interested in. I grew up in the country, and even my mother used to take me to like health food shops. So I was always interested in helping somebody. And because I was into Buddhism and I was really into meditation, I basically sort of came across it.
So you were into Buddhism?
I was into Vipassana meditation, which is all about self-care and just mindfulness and clearing the mind and basically putting yourself first and looking after yourself.
How did you come into the journey of studying Chinese medicine?
Well, I was actually into Vipassana, Buddhist meditation, and it came to me on a retreat that I should study Chinese medicine, and then I sort of followed it through. And I haven't regretted it because 17 years later, here I am still doing Chinese medicine. Mm-hmm. So it was like, for me, I feel like it was a higher self thing that I got that.
Awesome.
To go and do it.
Yeah, that's really good. I mean, everyone comes to Chinese medicine in a different way.
Yeah, that's right.
A really interesting question.
Yeah, it is interesting.
How do people get to do it? And I think that's why we're going to have that conversation today about self-care, because it's something that you through your studies in Vipassana and Buddhism, that you've kind of developed these things for patients to do.
That's right. And a lot of the things that I do, especially even in a treatment, I find that we live really in a busy world. And sometimes people just need a place to retreat and relax. And it's not really about just putting needles in, it's about connecting with self. And I find a lot of people don't know how to do that. Okay. Although mindfulness and all that sort of thing is coming in now, but connecting patients to self is one of my priorities because people are so much in their head or living a liverish life these days, lots of coffee, always on the go and not taking the time out to relax and be with one.
Yeah, right. Okay. And it's interesting you mentioned that mindfulness because it's something that is that's a big part of Chinese medicine in a way, but it's not been articulated like that.
That's exactly right.
It's something that it's trendy now.
Yes, and that's right.
There's research to prove the power of meditation, let's say, and mindfulness practices. And I think one thing is what we want to discuss today is it's easy to get caught up in the trends of something and go, I'm doing this for my self-care, but are they really? Are you just doing it to take a bubble bath so you can have an Instagram photo, or I took a bubble bath? Exactly.
And having time out is not necessarily, it's about nourishing all aspects, like your emotional aspect, just giving to yourself and not just having a bubble bath.
If someone asked you, what is self-care, what would you say? What is self-care?
Self-care, I would say, is about connecting to self. I find that's taking time out for yourself, not getting caught up in the busyness of life, switching your phone off, switching your TV off, and just relaxing and honouring where you are at. That's one thing I really, say to my patients after a treatment. Just honour where you're at, because with acupuncture it does balance your body. So you might feel really emotional, or you might feel really like you've got a lot of energy. So where you are, you don't deny, you just accept that you are where you are. Okay. And that's really important to say that to clients, because I think that's about honouring and nourishing yourself. And whatever that is, sometimes after acupuncture people just want to sleep, and that's actually okay. So it's just honouring what you need. That's what I see. That's nourishing really yourself.
Explanation.
Yeah, absolutely.
Because I think sometimes we might not know how to articulate those feelings.
Yes.
And people feel guilty about having those feelings.
Or sometimes people might want to blame the acupuncture or any of the treatments. It's like, well, how come I'm feeling angry? Well, you've always been angry. Maybe it's just brought it up to the surface, or those feelings were always there, but because we're so busy pressing them down and living busy lives and having coffee and social media and all that, we don't actually take the time to be with ourselves.
Yeah. And is that something like you find patients say, I feel angry after have you had?
Well, it depends what happens. Like if it's a liver qi stagnation, or depending on what happens. But yeah, I mean, I had one lady that actually slept for 48 hours after the treatment. She was so tired. But because she was living a very busy life, and that's all part of it. It's actually, we can never say what you're going to be feeling like after the treatment. But if you say to somebody, just honour where you're at, because it's really important. Some people might be really emotional, so it brings it up all to the surface, and they might go home and be really crying and really sad. So you are where you are, and it's really important to go, don't change it, just be with it. And that's part of the Buddhist way of life as well, just being present with what is without trying to change it through the mind.
Yeah, right. That's really important. That's interesting.
Absolutely, yeah.
Okay. And so what about people that are worried then? Would that be the common thing, to sleep 48 hours after a treatment?
It's not common. Look, in my 18 years experience, it's really the first time. I was also helping that lady to give up smoking. She actually gave up smoking through one of my treatments. But she was just running on exhaustion. She had a lot of, kidney deficiency, and she was just tired, and she needed the rest. And that's the other thing. Whatever your body needs, that's what you need. So don't deny it. Don't deny yourself what you need.
Yeah, that's something that's really probably, I don't know, pretty unique to Chinese medicine. When people come to practitioners, like especially when you're really in touch with like pulse diagnosis, it's kind of like the body's saying, treat this first, treat me now, treat this.
That's right.
And then it's
what's
kind of like a
present
layer,
now.
then what's next.
Yes.
And like if that person didn't sleep, like they obviously needed that sleep.
That's
they
right.
needed that rest, and if they didn't get it, like their whole body was running on adrenaline, obviously, to get.
That's right, and what I like to my clinic's about being present and getting the person connected, and that's why I went for an ocean theme, because the patients usually relate to the ocean or a waterfall in nature, and so if you're coming to a place that allows you just to be wherever whatever's going on out of your busy life, and you come into a clinic and you can just relax. That's all part of the treatment. Absolutely.
That's a big part of acupuncture, I think.
Yes.
I've some patients that have told me this is the only time I can feel this relaxed.
That's
and
right.
I come in like once a month.
Yes, that's right. Let them sleep.
Relaxed. That's
what they want. Everyone's living very busy lives now, especially for your mum and families and working, and there's not many places. Self-care and stopping and just being mindful of where you are today.
Okay, so let's say apart from acupuncture, what are some other things that people could do to help their self-care in that individualised kind of way?
Well, meditation's a really good thing. I would recommend meditation, and just being like aware of your thoughts as well. I mean, we have a lot of sometimes negative thoughts that we play out, and then we believe those things. So I think, just being mindful of where am I today? How is my head? Am I connected? Am I disconnected to my body? Am I living in my head today? Am I feeling, just being aware of even pain? Are they holding themselves quite tight, or are they relaxed? I think just checking in, within themselves daily is a good thing. Yeah,
and I think something that helps for people is first thing in the morning, what you do kind of sets the tone for your day.
Absolutely.
Right? So if you get up and the first thing you do is just scroll through your phone.
That's right.
Lots of people do.
Yes. Have a coffee and just
bombarded.
have a cigarette or whatever they do.
The first thing they do is they jump on the loo.
Yeah.
And they scroll their phone. And they're just looking at other people's lives. And that comparison and that kind of like, and it can be good. It's nice to see, Johnny had a baby and Susie, got flowers yesterday. But at the same time, that can help. It can be really hard for people that suffer with anxiety or negativity, or
that's exactly
they get
right.
depressed easily by that's not my life. They're better than me, and everyone's showing the highlights. They're not showing.
That's right, and everybody,
but
in their four walls, people do suffer, and sometimes silently. But those sorts of things, and connecting to self. I mean, connecting to people are important.
Meditation in the morning.
Absolutely, right? Or going to a park, and not everyone's got that in their busy day. But just, I believe that if you can do one thing a day that's nourishing for yourself. Even if it is a bubble bath, if it is just something that you can go, what am I going to do, you know, today for myself, you know, even if it's take yourself out for breakfast, or I don't know. I think it's really important because we get so caught up in the busyness of life.
So, Julie, that's great advice. So I think firstly, people just need to be aware, and there's lots of different ways people can be aware. But what about a person who says, well, I don't know how to be aware, I don't know.
So what I do to clients who've never had acupuncture before, or that they really live in their head, or highly anxious people, I like to, before I even put any needles in, because they don't really know who I am, so they've got to build a rapport with me. So what I do is I get them on the table and I just do a simple exercise where you just put your hands on your stomach, because when you breathing through your chest, you normally, like you're up, it brings you up to your head and you're normally quite anxious. So I like to bring people's awareness into their stomach. So the hara, that's what I
like the epigastric area, right?
Yeah, the lower sort of area. So under the dantian, if you want. And they get their hands and I get them to breathe. And
just on the belly button.
Yeah, so bringing their awareness into their stomach, because I think too many people are in their heads because of the busyness of life, and not you don't realise how shallow people actually do breathe, and especially the anxiety clients. They are really anxious, you know, or like this. So bringing their awareness down, and it can be just a simple exercise. And even the people with insomnia and they can't sleep at night. So I usually make a nice flower essence up, which is called Calm and Clear, and it helps to clear the mind. They're Australian bush flower essence I use. So they can use that just before sleep, or if they wake up at, you know, strange times in the middle of the night and they're feeling anxious and having nightmares. And I also make a little spray mist, and that's also got flower essence in it, and that just clears all the sort of, you know, puts positive ions in the air. Yeah. So what they do is they just do this breathing and breathing in and breathing out, and just feeling the connection and the awareness in the stomach. And a lot of the clients say that they really do, and a lot of them may cry and feel very anxious and very scared because, you know, it might be the first time they've ever connected to themselves. They just don't know what that's about. And then I might put a needle in and do some needling and some acupuncture, and that really calms them down. And, you know, there's a whole lot of other things I do, is like put some nice music on. I have, you know, aromatherapy, just anything and everything just to relax them. And then when they're relaxed, that's when I do the needling. And sometimes it's not a lot. It's just more for them to connect to themselves and just feeling centered with themselves, and to honour where they are at. If they're angry, if they're sad, if they're anxious, it's okay. You're in a safe spot, in a safe place. And I think that's really important.
That's a really different way to do the acupuncture.
Yeah, especially highly anxious people, because they're already scared, and needles, and people associate needles with a lot of different things. So you just put one needle in and just really get them into themselves and centered. It's more important for me.
Lots of acupuncturists will be able to work with you if you tell them beforehand, I'm scared of acupuncture. Like, I've had some patients that come to see me and they said, I'm petrified, but I want to try this.
Because they're thinking of blood test needles and stuff like that, and when you really do talk them through it, they realise it's, oh wow, it was in my head, I thought you were going to put a big, you know, needle or something in me or something. The association around needles and blood test and dentist and all those sorts of things can be fear, but you can really move people through it. And if you just get them to meditate and relax and feel the breath and how are you now, and build a rapport with your clients beforehand, then people do feel safe.
That's great. So it sounds like that's something you've got a lot of expertise in.
And I really do like treating people with that, because I think it's like, to see the change, it's like, oh wow, that's really great.
So if you're not in Brisbane, you can't come and see Julie, and you're worried, and you're watching this thinking, I'm a person that's pretty anxious, or you could talk about that to your acupuncturist or the person you're thinking about seeing before you book the appointment. I would encourage you to have a conversation with them and just mention that to them, and then they can work with you in that way. It's better for the acupuncturist to know up front that that's how you feel. I've had some patients that I've started the needling process, just how we normally would do it, and then they've told me after 2 or 3 needles. I mean, as an experienced acupuncturist, you can see, because sometimes people just suddenly break out into a sweat, and we want to make sure you're comfortable.
And not everyone tells you where they're at, but as acupuncturists, we do have to read people's demeanour and to have a sense of what's going on, because not everybody will verbalise it.
I've had some people that you can see their feet are kind of like this.
Yes.
And you're like, are you okay? Is that hurting? No, it's fine. It's fine. Especially men. They don't want to show
That's
in
exactly
pain.
right.
We don't want to
And
cause
they
you
internalise
pain.
it. Yeah.
I'm fine, it's okay.
Yeah.
And you're like, I can see that this is very painful for you, something's not right.
And there's usually an underlying, and sometimes you can talk to the person about it, and then it really opens up a whole can of worms and a backlog of emotions, and then you can sort of see that, and that's maybe not what they came for. They might have come for back pain, but that's what's amazing about this healing art is that you really can open up people and see other things behind what's manifested in their bodies. Yeah, absolutely.
But there are some acupuncturists out there that don't take the time to do what you're saying.
That's right.
And so that's why we're having these conversations on the podcast channel, so you sort of let people know, hey, these are kind of conversations
Different
you need to have with
styles
your practitioner, to let them know, and so that they can be informed, you can be informed, and also that there are different styles out there. And so if you've had acupuncture before and it's been painful or hurting or uncomfortable, then don't just dismiss the whole thing. There are different styles of different practitioners.
And something I'll say to my clients is that you really got to have a rapport with who you see, because you're going to have a bit of a journey with them, and you want to open up and feel comfortable. And if you don't feel comfortable with the person you're seeing, you're not going to open up and you're not going to feel safe. Absolutely. So it's really important to have a rapport with the person, where you can call them and ask them questions, after hours, or if there's something bothering you, because that's part of connection. And if you're not connected with the person, you won't have the best outcome with your treatments. You'll still get an outcome, but you won't have a rapport with the person, because you're just like, oh. Yeah.
So that breathing exercise that you give your patients to do, that meditational exercise before and during the treatment process, could people do something like that at home?
Well, yeah, that's the other thing I do for my insomnia clients as well. It's just putting the hands on, just breathing. What it does, it connects them to self, and it's not like they're not in their head. So yeah, I do a few little tips that people can do at home, just to. And a lot of people found that they go to sleep better. They're not so scared, because I also say whatever you're feeling. The anxiety might be there. And you can also bring your awareness down to your feet. If you're one that really feels lots of butterflies in the stomach and a lot of nervousness in the stomach, then don't go to the stomach. It's just trying to get you out of your head, even down in your toes if you have to. You can imagine someone's walking on the sand and, visualizing that sort of thing as well. But it just gets their attention out of their stomach if they're a highly anxious person, and out of their head. Just, it's a lot of,
Okay, great. All right. And what about, are there any other things that you give people as self-care tools or self-care things that they could do? Like, I mean, a lot of people know the old bubble bath thing, and then they just think, well, I don't have a bath, so what am I going to do?
Or like I said before, probably just more self-awareness can be more about connecting, asking yourself, what is it I need today? Maybe you need a nice nutritious meal. Maybe you just need to go for a walk, and it doesn't always have to be a busy life that we lead. We can actually take a step back. Maybe it's about listening to nice calming music. So my main aim is to get people to get in touch with what it is they need today, and doing that one thing a day, because everyone is so busy, and it can be the simplest thing, but it doesn't have to be a bubble bath. It can be being kind to yourself. Today I'm not going to listen to any of my negative thoughts. I'm going to listen to a positive podcast, or I'm going to go for a walk around the river, or it can be the simplest things. 10 minutes a day is just is a lot to give back to yourself.
Right. So it sounds like you're saying we need to just ask ourselves that question.
Absolutely,
and be aware of that,
yes.
And just not just get on, and then next thing you know, it's the next day. And
That's
then
right.
Thing you know, it's Friday and the weekend, and then it's Monday again.
And I find a lot of my my clients like to come for acupuncture just to take that time out, like you said before, just to go, you know what, there's nothing wrong with me. I don't have any health problems, but I actually like going there just to relax, because it's the only place where I feel like it's my little inner sanctuary where I can just shut the door and leave all my worries. And that's kind of one thing I do tell my clients, is just put all the worries out the door. They're going to be there when you get back out, so you must just come in and just connect with yourself, and give yourself, this is the fact that you're here today, it's a good start for self-care. You're doing something nice for yourself today.
That's really good advice. And it's really simple, and it might just sound like, wow, that's so simple, but it's easy to forget.
Well, it's manageable. You can do that yourself. You don't need to go and buy it. It's people don't do enough of it.
Yeah, awesome. So if you've got some ideas about self-care, maybe you've done some stuff yourself and you think this has worked really well for me, why don't you put that in the comments below, because we'd love to hear your ideas, and other people in our community would like to hear what you've done, what's worked for you. Maybe there's some resource out there that you want to share or something like that. Pop it in the comments below. We'd love to hear that. If you're listening on the audio, then you can jump on YouTube and put your comments and join our acupuncture and Chinese herbal medicine interested people community. People who love Chinese medicine and learning about Chinese medicine. You can put that in the comments on the YouTube channel. That's freely available for people to have a chat and a discussion there. So it's been so great to interview you today.
Oh, thank you. It's lovely. Thank you for coming all the way from Perth and coming to Brisbane. It's been lovely.
It's fantastic.
Yes.
And so Julie's clinic is in Brisbane, and which exact place? You're Bowen Hills?
Yes, 22 Campbell Street. I'm your local acupuncturist.
Awesome.
Bowen Hills.
Very specific there. We'll pop Julie's link to her clinic in the description below, so you can jump onto her website and find out more about stuff. Do you have a blog or anything that people can look at?
I have a Facebook page and an Instagram, which is turningpointacupuncture.com.au.
Awesome. So they can follow you.
And you can also book online at www.turningpointacupuncture.com.
No worries. We'll put all your links below, and you should definitely check it out, because if you are someone that lives in this area, like you're in Brisbane, I always encourage people to try to find an acupuncturist or a herbalist that is one, it has to be a bit local to you, because you need to have the treatment, but it doesn't have to be your next door neighbour acupuncturist, because there are so many styles of Chinese medicine. You need to find, like you said, you need to have a rapport with that person. And so by hearing about that person talk, I'm not every person's practitioner, you're not every person's practitioner.
That's right.
And so especially if you're someone that wants that bit of extra attention, it sounds like you're very nicely.
Yes,
very nice.
That's right. I give 110% to all my clients.
Nice. And,
yes.
So that's been awesome. So thank you so much for sharing your knowledge.
Thank you so much.
And,
yes.
And if you're watching this on YouTube, don't forget to click subscribe so that you never miss an episode of our new stuff when we're bringing it out. We've got lots of new content coming out over the next few weeks. Lots of interesting interviews and stuff to help you learn about Chinese medicine and discover Chinese medicine. So thank you so much for watching and listening, and we look forward to seeing you again on the next episode. Thanks for listening to the Chinese Medicine Podcast. Did you know we're also on TikTok? And you can find shorter videos on Facebook and Instagram that you might like to share with your friends and family. You can also find our podcast on Apple, Spotify, and all places where you listen to audio podcasts. I look forward to seeing you again on the next video soon. And we're going to talk about what are the really important things that people need to... That was a fail.